And we do begin again today with the fast-moving Omicron variant. A new NBC News tally shows the U.S. has surpassed 57 million COVID cases, and health experts warn the full extent of this COVID wave has yet to come. According to the CDC, the Omicron variant accounts for more than 95% of COVID cases in the U.S. Listen to that. And to put that in perspective, just 1 month ago, Omicron accounted for 1% of cases compared to the once dominant Delta variant. And take a look at this map. In just 1 week, 33 states and Washington, D.C. have set records for COVID cases, hospitalizations, or both. President Biden addressed the nation about the rise of cases and the importance of testing during his public address yesterday. Take a listen.
We're seeing COVID-19 cases among vaccinated in workplaces across America, including here at the White House. But if you're vaccinated and boosted, you are highly protected. You know, be concerned about Omicron, but don't be alarmed.
We have a team with us this morning, including Dr. Bob Lahita, to break down the newest guidelines from the CDC, and NBC News global security reporter Dan DeLuce with an update on military support inside struggling hospitals. But first, let's bring in NBC News correspondent Sam Brock and NBC News White House correspondent Monica Alba. Good morning to both of you. And Sam, I will start with you in Florida. So you're outside Jackson Memorial Hospital, I understand it, where, like much of the country, you're seeing this spike, but actually you are in the state seeing the fastest spike in COVID cases. Listen to this, up 744% in just the last 14 days. Tell us how that hospital behind you doing, what's happening in your state, what's it looking like right now, Sam?
Savannah, good morning. Right now, Florida has seen just this explosion of cases in the last couple of weeks. As you said, about 700% increase in infections. At the same time, you have seen a lot more hospitalizations, but not at that level, a couple 100% instead of 700%. What does that mean contextually, though? At the height of Delta, which was over the summer in Florida, there was about 17,000 people hospitalized in the state of Florida. Right now, it's about 7,000. The issue right now for healthcare workers, Savannah, is not necessarily available beds. They have the beds. The problem right now is not enough people, doctors and nurses, to take care of sick patients. Attrition and folks who have gotten sick themselves working on the front lines has driven down the availability and capability of hospitals to care for COVID-19 patients. Those patients are not getting as sick as they were during Delta. That comes directly from the Florida Hospital Association. There's also another difference with Delta. Here's the president speaking with us yesterday.
During Delta, over 50% of our ICU beds were occupied for individuals being treated for COVID at the peak of Delta. We're at about 12% today of our ICU beds occupied for COVID. The biggest challenge for all of our hospitals remains the severity of the staffing shortage.
And Savannah, another example of that, only about 30 or 40 minutes from where I am right now in Fort Lauderdale, there is Holy Cross, which had to shut down its labor and delivery unit, not because of unavailability of beds, because they don't have enough people to staff that unit. They had to divert critical staffing shortages, divert those folks to other areas of the hospital care for COVID-19 patients. That's the kind of thing you could continue to see here in Florida and elsewhere as this crisis deepens.
Absolutely. And a reminder of what happens other than just those beds filling up from COVID patients. There's so much more fallout than that. Monica, let's bring you in here. So we heard from President Biden yesterday, and we're expecting to hear from the White House COVID response team later this morning in a virtual briefing. What's the latest messaging there?
Well, ideally, we're going to be getting a few more specifics from that COVID response team, Savannah, because yesterday, President Biden conceded that the testing situation is frustrating to him. The fact that even the White House is falling short on its own promise that by early January, which is where we are right now, there would be this government website up and running or close to launch so that Americans could log on and get those at-home rapid tests sent to them via mail. As we all have seen and experienced, those are still very hard to come by. And the president did admit they would like to do more on this, but that he just couldn't announce anything further because the contracts are not even finalized. So that's something that really could stretch further into January. So we're waiting to hear more from the COVID response team. But I think you can also expect them to echo what the president hit home yesterday, which is that he said there's no excuse for anyone to be unvaccinated. And for those people who are vaccinated who might still be waiting to get their boosters, he said the time has never really been more urgent. So we could get some more information from the CDC today about particularly kids in the age range of 12 to 15 who might get final approval for their booster shots, and those timelines shrinking a little bit, especially for those who got Pfizer and the immunocompromised. So we expect to hear a little bit more about all of that. But the president's message also yesterday is what we expect to hear from these health officials. This is something to watch, to be vigilant, but not to be outright panicked at this moment.
And Sam, quickly before I let you both go, let's talk about the leadership in your state. Florida Governor Ron DeSantis is receiving some backlash for the way that he sort of categorized testing, calling for residents to not get tested if they're asymptomatic. First, let's listen to some of that.
You'll have certain people that will go out and will just get tested all the time at some of these sites, and that's not a good use of resources.
Testing people that have no symptoms, are not sick, and calling them cases, people, and making them into people who are sick when they have no symptoms. Let's go back to people making sort of voluntary decisions, living their lives, pursuing what they want, and not sort of defining everything that they do around whether or not a test is positive or something else like that.
So, Sam, tell us, how are people in the state responding to that? Are they struggling to get their hands on a test in the first place? What's been the backlash?
There was definitely a lot of curiosity, Savannah, as to how Governor DeSantis was going to address what is now a state that is awash in COVID cases. We had not heard from the governor in a couple of weeks over the holidays. So what was he going to come out and say? And yesterday, as you heard right there, asymptomatic people, according to Governor DeSantis, should not be getting tested right now, which really flies in the face of what scientists and infectious disease experts have been saying for weeks, months, years, which is that you can be asymptomatic and still pass the virus on to someone who is more vulnerable and will be symptomatic, could get very sick. So healthcare officials right now were apoplectic at what the governor said yesterday, and not just those remarks about changing the profile of who gets tested, but also he doubled down on monoclonal antibodies instead of talking about getting people vaccinated. Now, monoclonal antibodies, Regeneron specifically, did wonders for people during Delta here in Florida. But to kind of put all of your eggs in that basket right now, when you have a state that's 63% vaccinated, and where most of the people that are ending up in the hospital, including the 500 or so over my shoulder here at Jackson Health, are unvaccinated, you might have expected to hear more language on that, less on the monoclonal antibodies.
Sam, apoplectic. It's one of those words when used to describe something so well, it just really hits home. All right, Sam and Monica, thank you both so much for kicking us off this morning. Now, Chicago public school officials have canceled classes for hundreds of thousands of students after the teachers union voted to temporarily transition back to remote learning due to this spike we're seeing. At a press conference shortly before last night's vote, Chicago Mayor Lori Lightfoot compared the negotiations to Groundhog Day, criticizing the move as an illegal work stoppage. The teachers union tweeted in response that the move to remote learning will be temporary and will end when COVID-19 cases subside or the mayor signs an agreement with the union. Now, that vote comes as a staggering number of children are getting sick with COVID. Hospitalizations are skyrocketing as the majority of kids actually remain unvaccinated. We have the story of one 6-year-old who's been battling COVID for 3 weeks, and Vaughn Hilliard has her story from her hospital bed.
The numbers are stark. The country's youngest generation contracting COVID at a higher rate than at any point during the pandemic. This, the rise in new hospitalizations of kids under the age of 18, meteoric compared to any other point during the pandemic.
Aria, how many days have you been at the hospital now?
18.
Among them, 6-year-old Aria Shapiro, who has been battling COVID at Phoenix Children's Hospital for 18 days, celebrating the holidays from her hospital bed.
COVID really put Aria on a turn that I've never seen her epilepsy go in.
Aria, who is epileptic, had received only her first dose of the vaccine. Her mom, Sarah, now says she wishes they had gone earlier.
From what I've seen with my own eyes, that COVID is not safe for all children. And though I know my daughter has an underlying condition, there's a lot of other people here that don't have underlying conditions where children are struggling with COVID.
As the Omicron variant sweeps through the nation, it's infecting kids, many of them with their families scrambling to get vaccinated as school goes back into session.
Kids are definitely not immune to this virus. Although most children do okay, they have an upper respiratory condition or situation happening. There are some cases that are extremely serious.
All our friends are getting COVID. There's like half of our class is not here.
Yeah.
Cases among children are up more than 60%, with 300,000 new infections reported in the week after Christmas alone.
Most of those cases are mild, but over that same time period, 574 kids on average every day have been admitted to the hospital. That's double from the week before.
Before we had break here, it wasn't hard because there was like nobody out, but now there's like 5 or 6 kids out right now, and it's harder because a lot of them are our friends. So it's, for me, I'm just worrying about them now because I hope they're okay.
Despite the FDA approving the booster shot for kids 5 years and older just this week, most young kids in America have still yet to get even a single shot.
Have you gotten vaccinated yet?
Not yet.
Not yet. Has this led you to think more about getting vaccinated?
A little.
In the 2 months since the shots were authorized for children ages 5 to 11, just over 15% have been fully vaccinated. That number higher for children ages 12 to 17 at 53%, but still well below the average for adults.
How much more worried should parents be about their kids?
They should always be worried about the Omicron variant because they never know how their child is going to react if they get infected.
Many of them with their families scrambling to get vaccinated as school goes back into session.
Your second shot.
Yep.
Hey, so you're getting your vaccine. You're ready to go. Why did you decide to get your COVID vaccine?
Because I don't want to get sick.
This as other kids like Aria continue their fights in America's hospitals.
What would you tell other kids that are watching?
Be brave.
Be brave.
Thanks to Von Hilliard for that report. And doctors say parents can look out for symptoms in their kids like dehydration and trouble with breathing. Now, hospitals in some states are so overwhelmed with COVID cases that the military is being called in to help. At the request of FEMA, military medical personnel are now heading to New York and New Hampshire. 8 other states are already getting that assistance. NBC News global security reporter Dan DeLuce joins me now. Dan, good morning. So we're seeing these shortages of hospital workers across the country because they're either out sick with COVID, like so many people are from their jobs right now, or they're even leaving the field altogether because of this burnout they've experienced for nearly 2 years now. Tell us about this new deployment of military personnel to New York and New Hampshire and what's going on in those 8 other states.
That's right. You heard about the tremendous pressure on hospitals, on hospital staffs. And so the military has learned that an effective way they can help is to send these small teams of nurses, doctors, and paramedics to try to shore up the gap in the manpower shortage. And so what you have is this small team going to Buffalo and New York. You have another team going to Manchester, New Hampshire to help a hospital there. And they've already deployed teams across the country in 19 states. They have plans to send teams to another 10 states, including New York and New Hampshire. So this is the Pentagon's way of trying to stave off this tremendous pressure on the hospitals that are just finding, as you said, a lot of their own healthcare workers are out having to quarantine. And so they're really just facing this manpower problem. The other thing is that some states are mobilizing the National Guard also to try to make up the gap.
Mm-hmm. Now, Dan, what's this like when these military members join this fight? I mean, on that graphic there, we could see there's a 20-person team being deployed to Buffalo, New York, 15-person team being deployed to New Hampshire. What are they trained in? What kind of specific help are these military members providing here? I mean, are they used to being in this hospital environment?
These are very trained medical personnel, really experienced, seasoned professionals that are coming in. So think of it as a small cavalry arriving at the door when you're so shorthanded at a lot of these hospitals. So these are full-fledged doctors, very experienced nurses, paramedics, and other specialists that can literally just step right in, hit the ground running, no training required, know exactly what's required, including in an ICU situation, to help the hospitals cope with this influx of patients and the staffing shortage. So it's really a kind of a hidden military asset that a lot of people don't think of. And the military has been helping, of course, throughout the pandemic. And this is just another example.
Absolutely. Dan DeLuce, thank you so much for joining us to talk through this morning. Let's now bring in Dr. Bob Lahita for more on the latest COVID headlines we've been discussing here. Dr. Lahita, as you probably know, is the director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. He's also professor of medicine at Rutgers and New York Medical College. Doctor, good morning. Always great to have you. So let's start with the CDC guidelines on isolation. So the agency is standing by that decision to shorten the COVID isolation period to 5 days and to not require testing to lift isolation. First, let's listen to what CDC Director Walensky said about the guidelines on Monday.
We know, based on 2 years of experience now with this virus, that the vast majority of your transmissibility happens in the day or two before you get symptoms and the 2 to 3 days afterwards. So probably about 80 to 90% of all your transmissibility has happened in those first 5 days. And we really want people to be sure if they're going to be home, they're home for the right period of time when they're maximally transmissible.
What do you make of that decision to not test out of isolation, Dr. Bob?
Well, I think this is a very prudent thing to do, particularly since, as your previous reporter had said, that there is really a shortage of doctors and nurses, and we really need to maximize or actually take care of the time that our people have to be out, and we can't have them beyond 5 days incapacitated. They can wear masks and hats and goggles and everything, but continue to work. And they don't have to test after they've been infected and have been home for 5 days. We want everybody to wear a mask for 5 days after, and in the hospital, we wear N95 masks. So they don't have to retest once they have been now quarantined for 5 days and they're symptom-free. That's the most important thing, Savannah.
Symptom-free, all right. Now, the CDC is also updating its guidance for Pfizer booster shots. So they're recommending people get their third dose now 5 months after their initial series instead of 6 months. Dr. Bob, I think there's been so much confusion, and little changes like this, or hearing they should be wearing a different type of mask now, make people kind of confused, kind of concerned. I mean, what do you think about that change? Should people who got it 6 months, I mean, should there be any concern here?
No, there should be no concern, Savannah. This is all based on science and epidemiologic studies of the way both the Delta and the Omicron variant have been behaving over the last several weeks. So to lower the booster, and I'm asked this every day, to lower the booster hiatus, if you would, from 6 to 5 months is not a big deal. And I think it's going to help our employees, which particularly in the healthcare area, that are very, very tight and are lacking.
And Dr. Bob, with this variant, Omicron, it obviously is spreading so quickly. We've seen how quickly it's become this dominant variant as it sort of whips through the country. And we're seeing that a lot of these cases in vaccinated people are mostly mild. Then you come out of it and you presumably have this period of immunity. Is there light at the end of the tunnel here relatively soon if this is spreading so quickly? So many people are getting it. We're seeing these high case numbers, but then people have this immunity after?
So less than 58% of the population is vaccinated. So you're right. As the variant rips through the country, the Omicron variant, it creates a certain degree of immunity. For example, if you've been infected with Omicron, you're 4 times less likely to succumb to the Delta variant. So there's cross-reactive immunity. And so any infection, while being very bad, is going to give us immunity going forward, and maybe herd immunity.
All right. Well, that's a little bit of good news there. And Dr. Lahita, more good news. Congratulations to you. You have a new book out today called Immunity Strong. People who know that you're a friend of the show will probably be excited about this. Tell us quickly, what should viewers expect from your book?
The book tells you all about how the immune system works and all about vaccines, vaccination in a very simplified fashion so anybody can understand it. And I highly recommend it so that you understand what this pandemic is all about and how to keep yourself really strong, immunity strong and healthy.
Absolutely.
Savannah.
And that's what we love so much about you, Dr. Bob, is you do make it so simple for us to understand. And you see that little tidbit in the sub-headline there, live to 100, which is also a nice bonus there. Yeah. Dr. Bob Lahita, thank you so much for joining us, and congratulations again on this book. We're really excited for you.
Thanks, Savannah.
Now, the U.S. Capitol is on high alert this morning, just a day before the anniversary of the January 6th attack. NBC News senior congressional correspondent Garrett Haake takes us inside the security on Capitol Hill.
From the outside, the U.S. Capitol looks much like it did this time last year, before it's ransacked by rioters on January 6th.
The way the police department's operating, our equipment, our training, our planning, all has improved since then.
With $100 million from Congress, new Capitol Police Chief Tom Manger went to work reforming the department in July.
In terms of keeping this place safe, what keeps you up at night now?
I think that for right now it's the staffing issues. We're right now probably 200 officers below what we had pre-January 6th, and we're 400 below what we really need.
Congress also set aside $300 million for physical security improvements.
We have a significant effort of reinforcing the doors, both exterior and interior.
Democratic lawmakers point to some of their Republican colleagues' efforts to downplay the attack and the few who embrace violent language as a continuing security risk.
Does the rhetoric of some of the members here, the threats, the things of that nature, make your job harder?
It certainly has increased the workload. The threats against Congress have gone through the roof.
Are we safer here now than we were then?
I think moderately.
Democrat Tim Ryan oversees Capitol security funding.
Making all this safe would be expensive.
Yeah. It's expensive to have an insurrection, and they prevent a free and fair election from getting implemented. This is pennies on the dollar to protect our society.
Chief Manger told reporters there are no concerning threats to the Capitol tied to Thursday's anniversary.
All right, Garrett Haig, thanks for that report. Now, traffic on Interstate 95 near Washington, D.C., where you just saw Garrett, is finally moving again after being stopped for more than a day because of Monday's major snowstorm. This was the same Tuesday as crews tried to clear vehicles from the interstate around 7 p.m. last night. It reopened and traffic finally started moving again. So what can we expect in our forecast this morning? Is there more wild winter weather? Let's get a check on your forecast with Bill Cairns, of course. Hey, Bill, good morning.
Hey, good morning, Savannah. Yeah, already hearing reports outside of New York City. Some bridges are being closed because of freezing rain this morning. So this is a different beast than that big winter storm 2 days ago. Temperatures in the major cities are right around the freezing mark. So we had the storm from before that melted, and then some of that's refreezing. And then there's a light glaze of ice that's coming over the region, too. So, showing you some of the pictures of D.C. The good thing that happened yesterday was that the skies were clear, the sun was out, and that was able to clear up some of the roads and some of the ice that was on them as temperatures got into the upper 30s. So the roads are much better, but still, as I just said, some of that has, some of that melted and then is now refreezing too. So just be careful, especially on the sidewalks and some of those secondary roads. So let's get to the problems this morning. Notice the temperatures in the cities themselves were right around freezing to just above freezing. It's really in the suburbs outside of the cities that we're having issues. And if you look really closely at this map, you'll see that little pink from Philadelphia up to New York City, now heading up into the southern Hudson Valley and into Connecticut. There's a little area of freezing rain that is moving through this morning, and that's causing a lot of traffic accidents around New York City early today. And that's going to move up into Connecticut, Massachusetts, and eventually even New Hampshire and Maine as we go throughout the morning. That's why we have winter weather advisories. The other big weather story, there is a significant blast of cold air coming down through the northern plains. Wind chill advisories all the way down to North Texas, but it's those wind chill warnings that feel brutal this morning. Look at Glasgow, Montana, negative 48 wind chill when you step outside this morning. That is dangerous stuff, all the way into the negative 30s now, Rapid City and even Bismarck. And tomorrow morning, this blast of cold air moves all the way down. Even Kansas City will have a negative 11 wind chill. So, Savannah, winter has returned. And next hour, we'll talk more about the impending snowstorm that'll be heading for the East Coast come Friday.
Absolutely. It's either that winter has returned and with a vengeance, or that we have some climate change induced weird thing going on. I don't know which one I'd rather hear from you,
Maybe
Bill.
a little bit of both.
Yeah, exactly. All right, Bill, thanks so much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.